Yes, it is, and it is a Tuesday morning. Welcome to it, your Feel Good Breakfast Show, live, large and in charge. Thanks so much for joining us. Now, every year in October, we observe Breast Cancer Awareness Month. Now, breast cancer remains the leading cancer affecting women in the country. But on rare occasions, the disease also affects males. And here to give us insight into males' breast cancer and Breast Cancer Awareness Month in its entirety, please welcome specialist surgeon Dr. Justus Apfelstedt. Good to have you with us this morning. Thank you so much for being here.
Good morning, listeners. Good morning,
viewers.
and the Kugler. I don't know where to look at. I'm torn between the cameras and beautiful
us.
Kugler.
Oh, thank you so much. It's such a pleasure to have you here, Doctor, always.
Yeah.
And I think this conversation is a very important one because we know that breast cancer is very, prevalent within the female gender, etc. And one question that people are asking is, how common is it when it comes to males?
Okay, I've got a very good comparison. If you give me a soccer field and fill it with 1,000 men, one of them during his lifetime will suffer breast cancer. If you put 1,000 women in the soccer field, 100 will suffer breast cancer.
Wow.
Okay, so that's quite a significant difference. Talk to me about, when we are talking about that one man and the rare occasion when it does happen, how do the signs and the symptoms differ for men as they would for women?
Well, usually we men have smaller breasts than women, so we can easily palpate a nodule underneath our nipples, and then we should seek medical attention. Obviously, because the disease is so rare in men, there's no screening program as there is for women, where we can pick up the disease at an asymptomatic stage by merely doing an X-ray of the breast called a mammogram that everybody should know about, and then we can detect it very early and cure the women, and that's actually very important. Men don't have the same health-seeking behavior as women, so they usually leave it a little bit later.
That's so unfortunate. And then is it not necessarily like too late once you find that, there's a lump or they have breast cancer?
Actually not, because if men get breast cancer, it's usually at an advanced age, it's usually easily treatable, and so it doesn't make that much of an impact in men as it does in women, only if it's really neglected. If it breaks through the skin, for example, and if the men have signs of spread to other organs, like, for example, shortness of breath and back pain, that's if they really leave it late.
Now that we are also talking about the observation of Breast Cancer Awareness Month, how often should people be getting examined or tested?
Every woman should examine her breasts once a month, usually in the week after her period. If they are not getting periods anymore, it's still important, because breast cancer usually occurs after age 40 and mostly in menopause. So do it once a month, maybe at the full moon, maybe at the day you get your salary check, to see whether you can get double lucky. Otherwise, from age 40, it would be our goal that every South African woman from age 40 onwards should have every year a mammogram. And that is what we should work to, because then breast cancer would become curable.
Wow. And then in terms of trying to reduce the risk of getting breast cancer, does physical workout or eating healthy balanced diet, does it help reduce the risk of getting breast cancer?
Definitely so. For me, breast cancer is, to a large extent, a lifestyle disease. Because if you look at factors like obesity, if you're morbidly obese, your breast cancer risk goes up by at least 50%, if not double.
Wow.
If you drink more than 5 drinks a day, then again, 50% increase in breast cancer risk. If you do exercise, like we saw the 2 lovely ladies here earlier in the program, 4 hours of strenuous exercise per week will reduce your breast cancer risk by about 1/3. So we should ask ourselves, how many of us are actually adhering to those simple guidelines? And if that were the case, then we would see much less breast cancer. And if I can add here a favorite wisdom of mine, man, that obviously includes also women, lives only over 1/4 of what he eats. Of the other 3/4, us doctors live.
Wow.
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 Keep that in mind.
Think about that. Now, I was thinking about the other day, we reported in the news of the two exceptional ladies who have won Nobel Prizes for their work in science and being able to kind of split DNA and work on that kind of molecular level. In terms of cancer research and treatment, what does the future hold? Are we any closer to finding an actual ultimate cure to cancer?
You know, I don't think that there will ever be a cure for cancer that covers all cancers and everything. But what we have been doing is chipping away at the mortality of breast cancer at the rate of 1% per year. And if you look over the years, when I started in breast cancer, which is already about 3 decades ago, about 70 to 80% of women who would get breast cancer would die of it. These days, 70 or 80% of women survive breast cancer long term. So we have made enormous strides. And this is this small chipping away, here percentage, there percentage, and this will be the solution for it. And if then we can get our lifestyles right, well, then we have a cure for cancer.
We're absolutely there. And just interestingly, finally, Covid-19, the coronavirus pandemic, and breast cancer, how have those two interacted in this time?
They interacted in a very tragic way because we saw that women were not coming for their regular health checks. And now that the restrictions of the lockdown have been lifted and this fear of going to a hospital or to a medical practice is less, we see people arriving with advanced breast cancers that we could have cured. And if I have a plea to the listeners and viewers here, please do not neglect it. Your risk of dying of COVID-19 is less than 0.1%, which is very rare. If you have a lump in your breast and you wait 6 months, your chances of cure are largely gone.
Yeah.
Awesome, great advice there, and thank you very much for your time as always, Dr. Justus Apfelstedt, as we take a look at of course, Breast Cancer Awareness Month and receiving all these insights. So I think put that in your calendar right now.
Yeah,
if you can.
please.
Just remember that one day during the month that you will have yourself examined. And if, of course, you do find anything, do seek medical help as soon as possible. It is so important.
Well, after that very